Hey guys, welcome back to my channel. Thank you for watching this video. For those of you who are new, let me introduce myself. I am Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic, Mumbai. If you have subscribed to my channel, great. But if you haven't already done so, then please hit the subscribe button and press the bell icon to get regular updates and notifications. Today in this video, we are going to be talking about teeth cleaning. This is a very special video because this has been requested by one of my viewers. So thank you guys for inspiring me, and let those questions and requests keep coming. I know a lot of you must be wondering, right? What is this teeth cleaning? I've heard so much about it, say friends and family telling that, oh, I visited my dentist for a cleaning today. And you're wondering like, oh, my teeth are not bad. Why do I really need to go for a dental cleaning visit? And why does the doctor actually prescribe to get the cleaning done so often, like every 6 months? So if you're one of those people who have these questions in mind, then please see this video till the end, because I'm going to be talking all about what dental cleaning is, how it is performed, and also answering a few of the frequently asked questions. Okay, so before we talk about how dental cleaning is actually done or performed at the dental clinic, let us first start by understanding why it is so important to actually undergo this dental cleaning. What we typically do in a session of teeth cleaning at the dental clinic is we get rid of all the plaque and tartar which has formed and developed on your teeth. Now, what is plaque? Plaque is that sticky white film or the layer which develops on the surfaces of your teeth. Now, this white layer is full of germs and bacteria. It is soft initially, and at that stage it's called as plaque. But if the plaque is left unattended because you're not brushing properly, not following all the oral hygiene instructions that are given by your dentist, then this plaque further solidifies, or then it calcifies and gets mineralized into what is called as calculus. And these are not nice things to have in your mouth if you want good oral hygiene. So before we start, I'm going to give you not one, not two, but 5 reasons as to why you should get your teeth cleaning done regularly. Number 1, and the topmost reason, is to have a bright and beautiful smile. Now, who doesn't wish for it, right? If you're a tea or coffee drinker, or if you have some other habits like smoking, then you know that stains are inevitable. We are not very great with our oral hygiene maintenance, and after every cup of tea or coffee, we are not going to get up and rinse our mouth. And so that's why stains do happen. So what we do when you come in for your round of teeth cleaning is we get rid of all these stains, and we make your teeth and your smile beautiful, bright again. Number 2, teeth cleaning also helps in preventing gum disease. Now, what is gum disease? If you're somebody who has swollen or tender gums and they bleed easily to touch, say either while you're brushing or when you bite into something hard like an apple, then these all could be signs of the presence of gum disease in your mouth. Gum disease, or what we also call as gingivitis. Now, gum disease has many stages. It starts from gingivitis, but further, if left unattended or untreated, can lead to periodontitis, which is a very severe form of gum disease. And if you have periodontitis, then you're very likely to have teeth mobility or teeth shaking, and you may also lose your teeth at an early stage. So if you want to avoid any of these complications, then it's best that you maintain great oral hygiene and visit your dentist for the regular rounds of cleaning, because when we clean, we ensure that your plaque and tartar levels are under control and your oral bacteria levels are under control, which in turn helps to prevent gum diseases. Number 3, regular teeth cleaning also helps to prevent cavities. Now, your mouth actually hosts a lot of bacteria. Now, these bacteria are breeding or growing onto the plaque which is present in your mouth. And when they do so, as a byproduct, they release some acids, and these acids in turn cause tooth decay. So the best way to avoid caries or tooth decay is to ensure that all this plaque tartar is taken care of. And how do you do that? You know the answer by now. Regular teeth cleaning. Number 4, regular teeth cleaning also helps to prevent cardiovascular diseases or heart diseases. It sounds tricky, right? But wait, hear me out. Studies have shown and proved that those individuals who have cardiac diseases or cardiovascular diseases also have the presence of gum diseases simultaneously. There was a study which was conducted at Harvard University wherein this fact was established that more than 50% of those individuals who were reporting with the presence of active cardiovascular diseases also had unattended or uncontrolled gum diseases. What I'm trying to tell you here is not that if you have gum disease, you will get heart diseases, but you are more likely or you are predisposed to having cardiovascular diseases. And why does this happen? Because constant levels of gum inflammation and infection also means that there is higher level of inflammatory markers in your blood, and these inflammatory markers or inflammation in your blood further leads to development of cardiovascular diseases. So in order to break this vicious cycle, it is best that you visit your dentist regularly for teeth cleaning and you not just have a healthy smile, but also a healthy heart. Now the fifth and the last reason, regular teeth cleaning also helps in early detection of oral cancers. Now in a country like ours, where we know that a lot of the population is either chewing or smoking tobacco, oral cancer is inevitable. You'd be surprised to know that oral cancer is actually the third most common type of cancers seen in our country. So that's how important it is for early detection. We know prevention may not be possible if you're a smoker, but early detection is definitely the key to good health. So when you visit your dentist for regular cleanings, we also do a full mouth checkup and assess if you have any risk for development of oral cancers. So now that we've understood all about why we should be getting our teeth cleaned regularly, let's dive into the process of how it's actually done or performed by the dentist. So what exactly happens when you visit your dentist for the dental cleaning? Firstly, a thorough examination will be done to check the overall health of your mouth. And sometimes your dentist may also use a specialized instrument called as a periodontal probe. Now this is an instrument which will help your dentist to chart the levels of gum infection present in different areas of the mouth. So this helps in actually evaluating your gum health when you come in for your later follow-ups or checkups. The next and the most important step, which I never miss out, is using local anesthesia. Now I know that a lot of us already have dental fears and dental anxiety. We hate visiting our dentists. So as a dentist, it has always been my primary responsibility to make the dental visit very comfortable and pain-free for my patients. And we can only achieve so by using local anesthesia. So typically for your teeth cleanings, a local anesthesia will be used. Don't worry, it's not going to be in the form of an injection. Most likely it will be in a spray form, or it could also be a gel. When the dentist applies this all over your mouth, in a period of say 3 to 5 minutes, the anesthesia effects kick in, and then we're good to go and perform the procedure. Next, what we do is we use an ultrasonic scaler. Now this scaler basically has a metal tip which vibrates. It is based on the principles of ultrasonics, of course. And along with ultrasonics, there's also a jet of water or a stream of water which comes out, which helps to flush out all the debris. This vibrating tip, when used on the surfaces of your teeth, will help to dislodge or remove all the calcified calculus or the tartar which has been formed, and thus ensuring that your gums are back to healthy. The jet of water further enhances this process by penetrating deep into the pockets or the areas of the gums where the tip might not be able to reach, and it flushes out all the food and the debris. Your dentist will perform this procedure in sections or in areas of your mouth. And all in all, I would say the session of dental cleaning lasts anywhere between 30 to 40 minutes, depending on how much amount of plaque calculus you have, or if you have a lot of stains in calculus, maybe tea coffee stains also, then you could require a second sitting as well. And the last step after this round of cleaning is completed or done is the dentist will use a special paste to polish the enamel. This will just make sure that the enamel is sparkling clean, there's no plaque at all, and you get a beautiful bright smile. So that's it. That's how simple and easy it is. Now, before I go ahead into the last segment of this video and answer the FAQs, I'd just like to hand out 2 tips to you. Number 1 being, always get your teeth cleaning done at regular 6 monthly intervals or as prescribed by your dentist. Sometimes in diabetic cases, the dentist does often ask to come for your dental cleaning visits more often, say every 3 or 4 months, because if you're having uncontrolled diabetes, it's very likely that you have gum disease present alongside, and controlling gum disease will in turn help you control your diabetes levels. So don't forget to book your dental visits regularly every 6 months. Tip number 2. Don't forget to use the special medicaments or ointments that have been prescribed to you by your dentist. Now, these are going to be special medicines that help to heal the gums or get them back to health sooner. So if they've advised you to use this ointment, say after brushing, before brushing, or at night time, so please follow those instructions and don't forget to book your follow-up appointment. Now let's move on to the last segment of this video, which is the FAQs. Teeth cleaning being one of the most advised dental treatments, there is a lot of doubts and a lot of questions that everybody has, and I'm trying to answer as many of them as I can. The first question is, will I bleed when I get teeth cleaning done? The answer is yes. You will get a certain amount of bleeding, but don't worry, this is normal. In everybody who undergoes dental cleaning procedure, some amount of bleeding is likely and is expected, but this will stop in a period of say 10 to 15 minutes. So I would say even before you leave the dental clinic, the bleeding would have stopped, and this is not something that you should worry about. If you anyways had gingivitis present and your gums are swollen, it is very likely that they are going to bleed when we are using these ultrasonics and instruments around them. So don't bother, this is normal, and it's only ensuring that you get more healthy. The second question is, will it make my teeth look white? No. See, teeth cleaning will take care of the stains and the plaque and the calculus. So yes, the yellowness may be down by a bit, they may look cleaner and fresher, but the original color of your teeth will still remain the same. So if you're somebody who already had say slightly yellowish teeth, they're not going to become like 2 shades whiter and sparkly white. If you want something like that, then we advise patients to go for chemical treatments like teeth whitening and bleaching. But if you're just looking for good gum health and good oral hygiene, then regular rounds of teeth cleaning are more than sufficient. The third question, will it hurt too much? No guys, it's not going to hurt. If you have a dentist who is gentle and also uses local anesthesia, then being hurt or being under pain is out of question. Now the next question, will I get more sensitivity after I get my teeth cleaning done? So yes, the answer is yes, you will get or you will feel that you have more sensitivity, but this will only be for a very brief or a transitional period of time, say like for a week to 10 days. And in order to tackle this sensitivity, your dentist will most likely give you say either an ointment or a specialized anti-sensitivity toothpaste that you can use and deal with this problem. And also it's best that you avoid cold food for say about a week, like say colas and ice creams, etc. Now sensitivity happens typically because we are using a vibrating tip and your teeth is not routinely used to all these vibrations. The jet of water actually goes and forces itself into the gums, etc. So some areas which were covered earlier might get a little exposed, and this will give rise to sensitivity. But once the gums start healing and they start forming back, which will happen in say a period of 4 days to a week, your sensitivity levels will automatically start dropping and you'll be back to normal. Now the last question, again this is very commonly asked to me, will there be gaps in my teeth after I get my teeth cleaning done? No guys, we are here to clean your teeth, not to actually drill holes into them. It's not like we're taking away or removing a part of your tooth structure which will then lead to gaps between them. There are patients who do feel that this gap was not present earlier, but now I'm feeling it. The reason for that is because sometimes, especially in the lower segment, in the lower jaw front teeth, when you have receding gums and a lot of calculus has been formed in interdental areas or the areas between your teeth, when we do cleaning, all of that calculus and tartar comes off or is taken off. So that area which you're actually feeling empty right now was earlier loaded and packed with a lot of dirt and calculus. And once the teeth cleaning took it off or removed it, that's when you start feeling like, oh, this was, not present before. This is a gap which is newly formed. But it's not like the teeth cleaning is the reason for that gap. The gap was always present because you have receding gums. But the gap was filled with a lot of dirt, so you weren't able to feel it. And after your cleaning, when the dirt is flushed out, it's just more prominent and your tongue might go over there for a bit and you might feel it's a little awkward, and that's about it. So if you're thinking, will these gaps be filled back by their own? Will the gums grow back? So yes, if you have good oral hygiene and you're maintaining a good gum health, then yes, the gums are expected to grow back and fill all those spaces. So that's about it. I've spoken all about why teeth cleaning is required, how it's done, and also tried to answer some of the frequently asked questions or some questions that I'm sure a lot of you may be having in your minds. But if there are others which you haven't gotten the answer to in this video, then leave them in the comments below and I'll try my best to answer them as well. If you have any other questions, then keep them coming because they inspire me to make more such videos and answer them all. So as I say always, stay healthy and keep smiling.